Hi, my name is Mahala. I'm here to speak with Tamara Winfrey Harris to talk about the recent State of Women of Central Indiana report. Hi, Tamara, how are you?
Hi, how are you? I'm so happy to be with you here today. So, for those of you who don't know, Mahalit is a member of the Young Women's Advisory Council, and there are YWACs all over the country. But ours is a partnership between Women's Fund and the Centers of Wellness for Urban Women here in Indianapolis. And those young women are learning to change the world, which is why it's so exciting to talk to you today.
Thank you, Tamara. Can we talk about why the Women's Fund started this report and what you're hoping to achieve with it?
Sure. So there are really three main goals of this report. One, we wanted to make sure residents were educated. We can't make sure this is a great place for women to live unless we know exactly what women's experiences are. So we wanted residents to be educated so that they can vote and advocate for what's best for women and girls. We also wanted not for profits and service providers, people that make decisions for women to understand what their experiences were. We also wanted to guide philanthropy, so people like us. So, funders like Women's Fund, as they're making decisions on where their money and resources should go, we wanted them to have a good picture of where the challenges and opportunities were. And also, we heard from a lot of not for profits when we did community listening in 2023 that, especially the small ones, like they didn't have the resources to be able to do like a big study and to assemble lots of data. So we hope this will let them, not for profits, be able to seek funding easier because they have this data. And then lastly, we wanted to inform policy, right? The issues that are challenging women, we can't philanthropy our way out of it. It's not just about money, it's about what's going on in the state house. So we want to make sure that the people who are charged with making those decisions know what's going on with women and girls. And it really, there's a lot of valuable stuff in the report, but it really comes down to, how our community uses it. So, I really hope that residents and philanthropists and policymakers will really read and absorb it and then take action. So I'll just tell you a little bit about what's in the report. It really focuses on the health and well being of women, and it covers 10 major areas, and that includes housing and transportation and food security and other aspects of women's lives. We mostly focused on the 8 county central Indiana region, which are the areas that Women's Fund covers. So Marion County and all the color counties that touch it. But there's also some data for a few other, counties that are close by, and there's some statewide data in there as well as community voice, because we all know the data can't tell us everything. So we actually talk to women and service providers or women of women. Um, and here's a headline for you, and it's not a great one, unfortunately. But before we even went into this process, we knew that the Institute for Women's Policy Research, they keep this report card for each state, right? And based on sort of health and well-being, reproductive rights, employment and earnings, poverty and opportunity, work and family, violence and safety, and political participation, they've given Indiana a D, which is not a really good, not a great grade.
Yeah.
So we know that women in our state are really vulnerable. And on top of that, just like a few weeks ago, the US Women's Power and Influence Index came out, and Indiana is ranked in the bottom 10 states in terms of women's policy and influence. So we got a lot of work to do.
I agree.
So, one of the things that I've been saying and that I hope people who are watching this conversation take away is that women are 52% of the central Indiana population. So, we're about half of the population across the country, but we're the majority in central Indiana. So all of these things that don't work for us, if the community isn't working for us, it's just not working because we are the majority of the population. So I want people to think about that as they're looking at the results of the report.
I was recently struck by some of the data that was there, especially revolving maternal health and access to care. Can you talk a little bit about women's health and well-being here in Central Indiana?
Yes, it's so funny that you said that's the data that really struck you. It's because when we were doing community listening in 2023, that's what we heard from women is that far and away we asked them what issues we should be paying attention to, and they said far and away health. And when you look at the results in the report, you can see why. So we know that women in Indiana report experiencing poor health more frequently than men, and that economic barriers prevent about 10% of women from accessing the medical care that they need. And that share actually doubles for Hispanic women. Added to that, about 45% of Black and Hispanic women don't have access to first trimester care during pregnancy. And that's partly why Indiana has the third highest maternal mortality rate in the country. And Black mothers are particularly at risk. So, infant and maternal mortality rates in Indiana are not good, and it's an area of concern for a lot of women and a lot of decision makers. We also know that when it comes to mental health, that women in central Indiana have higher rates of emergency interventions. Um, Frequent mental distress actually affects about 20% of women, and especially in your age group. So, particularly in women 18 to 34. And for people who are watching who may have seen the Indiana Girl Report by our friends at Girl Scouts, then they'll know like girls are suffering too when it comes to mental health and depression and anxiety. So, if we don't solve that for girls, then as they get older, they're just going to carry that problem along with them. And then if they decide to become mothers, it's going to make them harder than to support their daughters and their sons. 30% of women reported experiencing depression, with the highest rates, again, being among women who are 18 to 34. So our young women are really hurting. Also, and an issue that's on lots of women's minds, and that is reproductive health. When we were talking to women, they talked about health in general, but they talked about reproductive health most of all. So, I think we all know, people listening, that as of August of 2023, there's a near total abortion ban in Indiana. So that reduces access to some health care and maternity care. So several women that we spoke to when doing the report kind of cited this and other challenges to birth control access as an example of how they felt that current policy in the state, especially around reproductive care, puts their health and well-being at risk, and that the people making the decisions maybe didn't have their well-being at top of mind.
Okay, so the wage gaps and poverty rates also stood out to me, and I just want to know a little bit more about the findings of women revolving employment and their earnings in employment.
Yeah, this is really important because, like, you, as you're embarking on your new life as a young woman, you want to be able to support yourself. But what we find, the gender wage gap, which we know is a problem all over the country, is 8 cents worse for women in Indiana. So, and then only four of the top or most common jobs in Indiana. So, out of the 20 most common jobs, only four of those pay at least $26 an hour. And $26 an hour is kind of the threshold for basic, it's like a basic housing wage in metro Indiana. So most of the most common jobs that people are likely to have wouldn't allow them to be able to pay for housing in metro Indy, which is hard because we have women leading a lot of families and they can't afford their housing. So Our state's largest single employer, public or private, is Walmart. So the average wage at Walmart is less than $15 an hour. Um, Women are the majority of retail and fast food workers. So, those wages don't tend to rise to the level that would allow women to support themselves. We know that Black women are most likely to work full time at near minimum wage. Because you have so many women in retail and fast food and hospitality and things like that, that means women are kind of the engine. You think of all the tourism and all the conferences that come into town and all these great sporting events. Women are kind of the engine for that, which is an important part of our economy. Yet, their own personal economy is struggling. Um, a positive is that since 2019, women in Indiana are more likely to have bachelor's degrees than their male counterparts. But young women, again, in your age group, 18 to 34, are more likely to live in poverty than any other age group. Single mothers are likely to fall below the ALICE threshold. So, do you know what ALICE
No,
is?
I do not. Can you
Okay,
tell
it is.
me?
So, for those who don't know, it's asset limited, income constrained, employed. So, that essentially means you're working, but you're still poor. You're still below the poverty level. So again, with all of that I said, it shouldn't be surprising, although it is unconscionable, that of all the evictions in Marion County, 61% of those are filed against women. Um, so there are also, in addition to that, in addition to being vulnerable when it comes to housing, there are about 100,000 women in central Indiana that live in food deserts. And very often, when you talk about food deserts, people assume that we're just talking about urban areas. That's not necessarily the case because 20% of the Shelby County population, which isn't very urban, also lives in a food desert.
There was a lot in the report revolving around women and their career and their caregiving responsibilities and how that kind of balances out.
Mm-hmm.
I wanted to know a little bit about what you found from the report revolving around women and their career and their home environment.
Mm-hmm. Yeah, this really touched me because the section on caregiving, I actually am a caregiver. Like my husband has a chronic illness, so I'm a caregiver. And I realized that I'm not alone, right? Because nearly 1 in 4 women in Indiana provide care to someone with health issues, especially Black women like me. So Black women make up about 26% of women caregivers, and then about 31% of those women are caring for someone that needs more than 40 hours of care. So that's a lot. And then you have these women who are in the sandwich generation. That's my generation. They're between like 45 and 64. So they're at an age where some of them, that's the highest percentage of caregivers. And so some of them, like you're taking care of kids. So you have kids still at an age that they need care, but then they may also be taking care of like parents or spouses and other people. So they're getting it on both ends. And if you think just of childcare, and I think we all know that women generally handle the majority of childcare. Well, unfortunately, the counties in central Indiana don't have enough licensed childcare to cover the need. So Marion County can cover about 84% of the child care need, but for instance, Hancock County can only cover about 46%. So you think about moms, you think about even single moms. Now, we heard about single moms and their income and their housing, and now you're hearing, gosh, it may even be hard for you to get support in taking care of your children. And we also think about all the discussions in the State House right now around Medicaid. And so, all of whatever is decided, that's going to disproportionately affect women because women are the majority of caregivers.
So I know the women's physical aspect of the study was
Mhm.
really an eye opener, and I wanted you to
Mhm.
talk a little bit more about that.
So again, when we talk to women, they were after health, they were concerned about economic mobility, They were concerned about girls' empowerment. They were also concerned about personal safety and intimate partner violence. So, Indiana is among the 10 states with some of the highest domestic violence rates. And in particular, I always say like all women have to deal with sexism and some of the um, inequities that come around gender, but how you have to deal with that depends on some of your intersecting identities. That can really impact how these things affect you. And so, Black women, women with disabilities, women who are members of the LGBTQ community, they all experience different rates and higher rates of domestic violence. 1 in 5 Indiana women have been sexually assaulted, unfortunately. And we know that we are seeing that violence starts early. So 17% of Indiana high school girls have said that they have experienced sexual violence. And we just know that nationally, those numbers are even higher for Black girls and other girls of color.
A lot of decisions that are being made about women's laws and
Mhm.
revolving around women in general are being made by these lawmakers, but we're finding that women are not being represented in these rooms. Can you tell us a little bit about what the report revealed about this situation?
So we know, as you said, women aren't adequately represented at the state or the federal level um, in Indiana. So if you look at the women in the state house, it is not on par with the fact that we are half of the Indiana population. And in fact, okay, this is going to drive you crazy. Indiana is one of only 5 states that have never elected a woman as governor or as a senator.
Really?
Yeah, we are. So we need more women. So I hope everyone's listening. We need more women in city and state government and our national government. Part of the reason I say that is because the more we have people in those spaces that understand our experiences and can bring our voices to the table, it's important. As I said before, data alone doesn't help. It is data plus women explaining the intricacies of some of those experiences. Women's voices are central to the report and they're central to making change. Denisha Posey, who is actually one of our board members for Women's Fund of Central Indiana, and she's the CEO of Impacto Strategies, she actually says in the report that policymakers should be listening to women. If we're not listening to women and their needs, we will continue to do a disservice. And I very much believe that that is true. Women need representation and we need to listen to women. So I encourage people, I hope you will read this report, but don't just take the data that you find here. Actually, then go and sit down and talk to the women in your lives. And you talk to young women about you and hear the realities and the intricacies and the personal stories that come behind the report.
So we have all this
Mhm.
powerful data. How can we move the needle for all of these women in central Indiana?
So I feel like we can do a few things. And I said a little bit of, I hope people will make sure to read this report. I hope they will talk and listen to women in their lives. And I hope they will pass this report along to the decision makers that we know. Like we hope that, teachers and principals and city government leaders and anyone who influences the lives of women and girls, we hope they will read this report. And I hope that then you will use that knowledge to advocate and speak up for women. So let the data that you have here lead you, the decisions that you make in your workplace. Think about this information when you're voting. Think about now is not the time to be quiet. So if you are reading this report and you say, I don't like this, and I hope that is what you say when you read this report, then now it's up to you to take action. And that means making sure you are talking to your legislators and your mayors, and you're talking to people, and you're going to school board meetings, and you're saying the things, and you're making sure that they know this information so they make and hold them accountable to making good decisions for women and girls.
So this report has some very heavy findings that are very painful
Mhm.
for women and girls like me to hear. But I feel very encouraged to know that there are
Mhm.
organizations and people out there striving to make Indiana and the world in general better for us. And I just wanted to know if you had any hopeful or joyful comments to share for the women and girls out there.
Well, the thing that always gives me hope, one, is you and young women like you. And plus, a lot of the groups and the women that we talk to throughout the report, the reality is there are lots of women and allies that are working every day to change the bad information that you receive in this report. And that gives me hope that there continue to be generations of women who continue to work, who continue to see results like this and agree that it's not okay, and agree that we need to do something about it. And at the end of the day, it is still joyful and awesome to be a woman. And I think we need to hold on to that. And how do we build on that and make sure that all women and girls have an opportunity to reach their full potential? And I think we can do it.
I agree.